core value of a diverse and inclusive community, it is an institutional responsibility to recognize and acknowledge the people, culture, and history that make up the Wildcat community. At the institutional level, it is important to be proactive in broadening awareness throughout campus to ensure our students feel represented and valued. Thank you, and I'm excited to begin our blast.
Well, thank you, Arvine. Thank you for acknowledging the indigenous lands that we sit on and that we're very fortunate to be here in Arizona. On behalf of the University of Arizona and the A Center Pre-Health Professions Advising Program, I want to welcome everybody to our 8th annual and first ever virtual, because of COVID, welcome, pre-health blast, due to COVID, and it's still raging. So please, everybody be safe and wear a mask and stay safe. And so we're very excited to put on this program. My name is Josephine Janorgan. I'm the Associate Director for the A Center and Coordinator of the Pre-Health Professions Advising Center. I'm an alumnus of the U of A and also native Tucsonian, and I'm first in my family to graduate from college and also to get a graduate degree. My parents immigrated from China in the 1940s, and I'm very proud to be in higher education and really love my job as far as working with pre-health students. It's a population that I feel very closely with and have been doing it for over 20 years. Many of our panelists and our faculty, we've known each other for years, and I want to thank those folks for being here again. And so we are physically located in a new building. We used to be in Bear Down Gym. So if any of you have come in for advising, we used to be in Bear Down Gym. We're now in the Bartlett Academic Success Center, which is right behind Bear Down Gym. And just to let you know that there are over 12,000 students at U of A who indicate that they're interested in pursuing a health profession. So every one of these students needs assistance along the way. And we work with all those students and students who also intend to come to the U of A. One of the focuses that we have in one of our breakouts today is working with transfer students who haven't transferred yet. And if you've ever been a transfer student, and I welcome those transfer students and representatives from the community colleges that are attending today's workshop, it is really important for those transfer students to gain that information before they get here. And for our undergrads to really gain the information and accurate information about the health profession that they choose to pursue. I want to introduce our pre-health advising team. And you would think that, such a wonderful program. We have over 200 students attending today in our virtual pre-health blast. I want to introduce Ethan Bull. He's a pre-health advisor, and also he coordinates, and many of you might be involved in this too, in the Patient Experience Ambassador Program that we partner with Banner. It's a 2-semester internship, and we select 40 students. That application will open up in the spring, so stay tuned for that. And also Renee Lozano, who coordinates the Ambassador Program. And this is one of the biggest programs that we have is BLAST. And so thank you, Renee, for putting this all together, and also for our ambassadors who really work very hard, and you'll hear from them today too. So more importantly, we want to make sure that today's event, that your experience is a positive one. You're going to gain a lot of information today. But one thing I want to reassure you is that you will receive contact information from our panelists. And so follow-up questions, we encourage that you follow up with them. This event actually started in 2013 with a cohort of pre-health ambassadors who really identified that freshmen, sophomores, and other students needed information about getting to know faculty, getting letters of recommendation. How do you get clinical experience? What is it like to be in a health profession school, to be in PT school or OT school or medical school? We're really fortunate that this program has been around for a while, that many of our ambassadors, it's full circle, they're coming back. Karavi is actually in a Doctor of Podiatric Medicine at Midwestern University. She will be on one of the panels today. Ilya will also be in our transfer student rotation, and he transferred from Phoenix Community College. And so Ilya, who is an ambassador and also first year at College of Medicine Tucson, will help out. So it's kind of neat to see all these individuals coming back and giving back, knowing that it's going to be busy being in a health profession program. And so we're really excited about that. So you are going to hear from our guest panelists share an overwhelming amount of information Just know that those breakouts are fast for a reason. And it is called information blast because they're going to hit you with a lot of information. And the sessions are going to be recorded. So if you need to go back and take a look at it, we will have it on our website to take a look at. And so this is the reason why it's called Blast. It was a brainchild of ambassadors. It's continued for 8 years. So be reassured that you will get contact information. Our hope is that you will follow up with them. A lot of times students are hesitant. This is a welcoming opportunity for you. So again, welcome and enjoy your day. We look forward to the sessions. And it is with great pleasure that I introduce you to Cassie Everly, who's a first year at College of Medicine, Phoenix. She was a pre-health ambassador from 2016 to 2017. And for the ambassadors, those ambassadors that are selected actually go through a process where the previous ambassadors select them and they look through applications and they interview them. Cassie has been on both ends of being an applicant as an ambassador and also interviewing other ambassadors. And so we're very excited that she's been able to take the time today and really talk to you and maybe share some insight about where she's coming from. But thank you so much, Cassie. Everybody enjoy your day. I look forward to seeing those in the transfer breakout. And if you have any questions, please feel free to reach out to us. So here's Cassie.
Thank you so much, Josie. Renee, are you able to give me screen sharing ability?
Yep, you should be able to do it now.
All right. Are people seeing it in the presenter view or in, like, are you seeing my slides or are you seeing the presenter view?
I think presenter view, yes.
Let's see if I can do it this way.
Maybe swap displays. I know I have the same issue when I'm presenting if I have more than one monitor attached.
Let me see if I can switch. One sec. I usually do it with Google Slides, so it's a little bit different.
If you go to the slideshow tab in PowerPoint, there's a checkbox you can uncheck that says use presenter view or not use presenter view, but you don't get to see both of them.
Let me try this real fast. Let's share that one. Let's do this. There we go.
There we go.
And that now?
Yes.
All right. Whew, technical difficulties. All right, so like Josie said, my name is Cassie Everly, and I am a former, we called ourselves Pulse Cats ambassadors at the time, but pre-health profession ambassador. I graduated from the University of Arizona in 2017. That was the year I was the pre-health ambassador. And I really wanted to be a pre-health ambassador early on. I applied 3 times and only got accepted my 3rd time. So if that's something you guys are interested in and you apply and you want to do it and you don't get accepted the first time, totally okay. You just keep trying for that position and it might work out. So I wanted to talk to you today a little bit about my pathway to medical school, and then share a few words of wisdom that I have gleaned over the past few years. So to begin, I went to U of A for my undergrad. I majored in physiology and I minored in psychology. A few extracurricular activities that I did. I was a volunteer at it was not in a clinical experience, but it was in the community, and I volunteered at an organization that supported children who had lost family members. And that was a really good experience, and it was good to get out into the world and to see what real people's lives are like. And something that I was always concerned about was I don't know if I should get experience that's not clinical, because clinical is really important. But I found that working in the community and being in that environment was very helpful. And so I know with COVID, things are very difficult, and clinical experience might not be something that's very attainable right now, just because of the hospitals being a less safe place, and they're not even letting med students in at this point. So don't be afraid to get your volunteer experience outside of clinical experience. I did find it to be very helpful, and on my applications and in my interviews and stuff, it was very helpful to talk about that. I did research for 3 years with a physiology professor, and I think that having a longitudinal relationship with somebody was very helpful for me. So if you're interested in doing research, or if that's something that your pre-health profession recommends, then I highly recommend trying to get started with that early on, because having that long-term relationship was really helpful for me. And again, something good to talk about on my applications. And then I also got involved with some student organizations. I was involved with the physiology club. For those of you who know Dr. Cohen, she's the physiology club queen over there. So I was involved with that for a few years, and I actually ended up being vice president of the physiology club my senior year. That was fun. And then I did a few other things with SAIL, the student ambassadors for improved learning. That was a unique experience where I got to work with some faculty members and really get their insights on things. I'm gonna go ahead. So I put these two up together because they kind of intertwine. And I want to emphasize this as applications plural and gap years plural. So I graduated in 2017, and I submitted my first application right out of undergrad. And I had all my hopes. I had a great GPA. I'd taken my MCAT and done well. I had all the experience. I felt good. And first year round, I applied to 15 schools, got 2 interviews, and got rejected. And I was heartbroken. I was just so devastated, and it was a very emotionally charged experience. But I had a mentor at the time who stopped me, and she said, hey, you know what? This could really be a good thing for you. You know, you have another year to grow and to learn and to just develop outside of the constraints of your health profession. So I didn't believe it at the time, but looking back, it was definitely very true. So second year round, I applied to 12 schools, and I got 0 interviews, nothing. And I was, again, just sad and devastated, but I was like, I knew that I wanted to pursue this profession. And so I picked myself up again, and year 3 applied, and year 3 was a charm. I applied to 10 schools, got interviews at 4 schools, and got accepted to U of A Phoenix. And that's where I am now. And yeah, so that was a little overview of my path to medical school. And then I have a few little tidbits of knowledge and wisdom that I gained over the few years I've been in this process that I wanted to share with you. The first is talk to your pre-health advisors. Talk to them early and talk to them often, because these individuals know what's true and what's real, and they are up to date on all the information that will be helpful for you. I've heard from classmates of mine who are in school now that they've met with their pre-health advisors at their school, and they were told that they're not going to be able to make it to med school, that they don't have what it takes. That is not what I have found to be true for this school. These pre-health advisors, they've got your back. They know what's going on. And if you start early with them, they can really help you develop a plan for your 4 years, or if you're a transfer student, your 2 years, whatnot, so that you're able to be as prepared as possible. And they really helped me along the way. I always left feeling, confident and happy, and all of my anxieties and concerns were taken away after I talked to them. So talk to your pre-health advisor is my number one bit of advice. And this bit of advice, I talked to some of my classmates, and I wanted to get their take on what they would tell people would be the most important bit of information. And they said that it's super, and I agree with this, super important to do things that you love, because those will be very meaningful for you. You'll be so much easier to talk about them on your personal statement, to talk about them in interviews, and they will just make your life easier as a pre-health student. I understand there are a lot of pressures. You have to work on getting good grades, all these extracurriculars and stuff, But if you can put the effort into finding something that you love, it will really pay off. And that actually might look like trying a lot of different things and saying no to things. I know it's really hard to say no to things when you're supposed to do everything and it looks good on your resume, but if you're not enjoying it, if it's not bringing energy back to you, recognize that it's okay to say no. So that's my number 2. Number 3 is have a plan B. Now, this sounds like advice that you don't want to hear, and I didn't want to hear it when I was given this piece of advice. My mentor actually said this to me in my second round of applications after I got no interviews, nothing. And she said, have a plan B. And I thought, what are you talking about? Med school is what I want to do. I've always wanted to do this. I'm not giving up on this dream of mine. And she said, no. Plan B doesn't mean give up on your dreams. Plan B means, what are you doing today that will make the future be okay if you don't get into med school this year? And that kind of surprised me. I was like, oh, that makes sense. Because in this application cycle in pre-health professions, there's so many unknowns and there's so many things you can't control. But what you can control is what you do today. And if you work today to do something that will make your future okay, if you don't get in this year, then it's a win-win. So you have a good job or a good, you're pursuing further education, that's a good path, even if you don't get in, which is your number 1 choice. I 100% am a fan of plan Bs, not giving up your dream, but knowing that what you're doing today will help in the future. Stay in your own lane. This is something that I continually run into on a weekly basis. You're going to meet students that are like you, applying for your same programs, who have impeccable resumes, who have done all types of experiences, who have amazing grades. And it is so easy to fall into the comparison game and think, oh no, they have so much more than me. They're doing this. I better be doing that. Try your best not to fall into that game, because you have no control over what they're doing. You only have control over what you're doing. So listen to them. If they have good ideas, check with your pre-health advisor, make sure that that is on track with what you're doing, but then just don't worry about it. Just let it go. My classmates are very intelligent people. They're very smart, and they'll start posting about all the different study things that they're doing. And I get nervous and I think, oh no, I should be doing that. I should be doing that. And then I have to realize that's not my game. That's their game. I got to work on what I know I'm doing and my path right now. So stay in your own lane. It's a hard one, and you have to remember to do it often, because it becomes super easy to, especially when you're in some competitive programs trying to get into a spot that there are, one person for, or one spot for 1,000 people. But do your best to stay in your lane. It will help you be a lot less stressed if that's possible. And then the last bit of advice, which I think is the most important, is put in your best effort every day. Put in your best effort. But at the end of the day, recognize that that is going to be enough. You're going to end up where you're supposed to end up. And I believe this wholeheartedly, as somebody who it took multiple years to get where I am, and I would not have chosen it this way, but you will end up where you're supposed to be. And your best effort is all that you can ask of yourself. So put in your best effort, work hard every day. But if things aren't working out the way you planned, just know that you're going to end up where you're supposed to be. And I want to thank you guys for listening to me today. And here's my email address. If anybody has any questions or wants to reach out, I love working with students. I'd be glad to talk to you, email, whatever. But thank you so much for listening today.
Thank you, Cassandra. And we'll make sure to send out your email after, since we have everybody's email because they had to register. So it's easier to send out information that way. So thank you very much for your story and for sharing it with us. So next we have the pre-health ambassadors. And so that's a group that I work with. And so I just want to thank them for all their help in setting up BLAST, and then selecting panelists, and really it's a really different year. And so I especially want to thank him for hanging in there with us and coming to our Zoom meetings, even though they've probably been on Zoom all day, And so, and I hear you. It's hard, and it's hard on your eyes and hard on your brain sitting there and in the same spot. So thank you very much, and for everything you do, and for making my day interesting too. So and so I want to pass it on to Arvine, who will take it from here and have some words about ambassadors and how you can get involved.
Hi all. So did you, Renee, enable screen sharing?
Yes, you should be able to share.
Okay, perfect. Thank you. Okay. Can you guys see it normally? Perfect. So I'm Arvine Asgar, and I am a pre-health ambassador, and I've been with the pre-health ambassadors for about 3 years now. And this experience has given me basically every experience that I could ever ask for in terms of leadership, in terms of finding mentors, advisors, and it's really because of the staff. And I just wanted to say thank you to all of our mentors and the staff at the A Center, which is now the Bartlett Center, I think. So basically, as pre-health ambassadors, we assist pre-health advisors in recruitment, outreach activities, workshops, and events. And Blast is actually one of the events that we usually put together every year. We find panelists, have the schedule ready, and the idea really came about, as Josie said, a couple years ago when students really took on their own initiative and said that they wanted to do something different. And a lot of the questions that pre-health students were asking were about letters of recommendation, where to get clinical and volunteering experiences, as well as shadowing experiences and things of that nature. So to be able to have an event where we're able to bring together the admissions committees, people from our community to be able to tell us about how to get recommendation letters, clinical and volunteering opportunities, and just meeting staff is really important to us. So we usually organize the Pre-Health Ambassador Blast, which is in the fall, and then in the springtime, we help organize the Health Professions Week and the Health Expo, which is gonna look different this year, I'm assuming, but that is where most of the different schools come in and we talk to them, and we basically just have a place for them to come present with their school and represent. So who is eligible? Basically any undergraduate who has a minimum of a 2.5 minimum GPA, you're interested in health professions, and you have a commitment to serve at least for 1 full academic year. We really like to have diversity within our pre-health ambassadors so that we are able to talk to other students and really be able to connect with them and tell them our own paths. But that, so just know that anyone, any profession is really welcomed, and it would be great to have you guys. So I just wanted to put out an interest form. If you guys are interested, our application will not come out until February of 2021. However, we will have info sessions prior to that. And then if you're interested right now, you can scan that QR code or click on that Google Docs, which I will send in the chat. And if you guys are interested, please fill it out and we'll send you an email when we have info sessions and the application opens. So if you guys have any questions, please feel free to reach out. I'll also put my email down in the chat, but yeah.
All right, so who's next on the list? Is it Yaneli? So if you want to start with introductions, so ambassadors, follow that list I gave you and introduce yourselves. And like I said, make sure you tell them your name, what did I say, major, the year you're in school, and the health profession you're interested in.
Should I go first?
I think Yaneli's trying to, but I think her speakers might not. So if you want to go, Arvine, and then we'll come back to Yaneli.
Sure. So my name is Arvine Asgar. I am a pre-health ambassador, and my majors are nutrition and molecular and cellular biology with a minor in Spanish, and I have hopes of going to medical school, and I'm currently applying to medical schools right now. And next on that list is Yaneli, if she's still working.
We'll come back to you, Annalise. So go to the next. I think she's trying to connect.
Lady, you wanna go ahead?
Yes. Hello, everyone. Good morning. My name is Lady. I'm currently a sophomore at the University of Arizona studying pre-public health and speech, language, and hearing sciences. My pronouns are she, her, hers, by the way. I don't have a specific health profession in mind yet, so it's not a set health profession, but I envision myself either becoming a physician in the future, so med school, or becoming an SLP, speech language pathologist. It's nice to see everyone here.
All right, I'll go next. Good morning, everyone. Thank you all for joining us today. My name is Bridge Kathuria. I am a senior here at the U of A studying physiology and molecular and cellular biology, or MCB. I've been fortunate to be a pre-health ambassador now for about 1.5 years, going on 2 years, and I am also currently applying to medicine.
I'll go next. My name's Anam. I'm a sophomore. I'm majoring in nutritional sciences, and my goal is to become a dentist one day. And I'll pass it on to Lauren next. Okay, I don't think Lauren is here, so I'll pass it on to Sarah then.
Hi everyone, my name's Sarah. I'm a senior and my major is psychology with a minor in biochemistry. And I plan to attend medical school. I'm applying in the spring. And then I'll pass it on to Bella.
Hi guys, my name is Bella Redpath. I've been a pre-health ambassador for about 1.5 years now. My major is physiology with a minor in biochemistry. And my hope is also to go to medical school, hopefully, and become a physician. And now I will pass it off to Kobe.
Good morning, everyone. My name is Kobe Saldana. I'm currently a senior majoring in physiology, minoring in biochemistry. This is my second year as a pre-health ambassador, and I am currently applying to medical school. And we can go ahead and pass it on to Angelina.
Hello, everyone. My name's Angelina. I'm a sophomore at the U of A. I'm majoring in neuroscience and cognitive science with a minor in music and biochem. This is my first year being a pre-health ambassador. And in terms of my future health position, I'm not entirely sure yet, but I do know that I do want to go into the health field.
Thank you. And Yaneli, I think you came back.
Yeah, sorry, I lost connection. Hi, I'm Yaneli Bolanos. I'm a sophomore at the University of Arizona. I'm studying biochemistry and Spanish, and this is my first year as a pre-health ambassador. And I hope to go to the medical field, but specifically I want to be an emergency room doctor.
All right. Well, thank you all to all the ambassadors. And again, thank you for all your help. Thank you for all you do. I know it's been a interesting year for all of us, especially for you seniors who will be graduating or those applying to medical school now. I know it probably looks very, very different than what you thought it would look when it was your turn to apply. So hang in there, and if you need to vent, we're always available. And so we also have life management person in our office. So if you ever need to speak to somebody that is not us, just let us know. Check our website. We do have their info there, and they're always available to talk, because these are times that sometimes you need someone to talk to. So if you do, like I said, the A Center does have a life management person to talk to you. So next on our list we have Dr. Eliza Yellowbird, and so I will let her take it from here. Thank you, Eliza.
Thank you, Renee, and welcome everyone. I'm so excited to be here and to get to know you all virtually. It was so cool to see all the ambassadors go through and introduce themselves and share what their interests and passions were and kind of what these next steps are. So I'm really excited to share pretty briefly here. Like Josie said, it's a blast. So you're going to get a lot of information from me in about the next 10 minutes or so. So I'll try to get through it pretty quickly, but if you have any questions following, like Renee said, just follow up in an email. I'm pretty responsive, and if I don't have the answers, I'll make sure to get you connected with somebody who will. So with that, Similar to previous folks, I'm going to share my PowerPoint slides here really quick. And I actually have a cool video that our office made. So give me 2 seconds. For some reason, my PowerPoint slides aren't showing. Okay, so while I figure this out, I'm going to introduce myself to y'all. So in my native language of Hidatsa, I'm originally from North Dakota. So Doja Nachpago means Mirachubawaya means Aoche. I just want to say hello, welcome everyone. I'm an enrolled member of the 3 affiliated tribes up in North Dakota. And so I'm just super excited to be here to share with you about our office. I work in the Office of Equity, Diversity, and Inclusion, and I am the Director of Student Services and also the Program Manager for AZ Hope. And so I'm really excited to share with you all about what AZ Hope is and about some of the opportunities that you all can apply for. So give me a quick thumbs up if y'all can see my slides here. I was able to figure it out. Okay. Perfect. Thank you. Thank you. So that's my email. Again, it's going to be sent out later, but I do want to kind of respect y'all's time. So this is some of our EDI team here. We have a LGBTQ interest group. And so this was at our symposium. And so with this, I'm actually going to, I just started screen sharing, but I'm going to stop the screen share to go share a video from our office. So it kind of gives you an opportunity to get to know some of our team and what we do at the Office of Equity, Diversity, and Inclusion. And if you have any interest in learning more about these programs, definitely reach out to me and I can connect you with folks. Additionally, I believe later on in some of the breakout sessions, you'll be able to hear from Dr. Zepian. She's one of our coordinators within our office as well. So with that, hopefully we don't get any technical issues here. If y'all can give me thumbs up once I start the video so I can know you can hear it, that would be amazing as well.
Welcome, Wildcats. Our office provides great resources to support you on your path to becoming a health scientist or health professional.
If you would like to partner or collaborate with our office or learn more about our UHS LGBTQ plus interest group, contact me.
If you're interested in learning more about UHS and EDI programs and resources, contact me.
If you're a junior in high school interested in health careers, contact me.
If you're looking for information on evaluation or assessment, contact me.
If you want to learn about undergrad research opportunities o hablas español y quieres horas clínicas, contact me.
If you're a health science student interested in gaining clinical shadowing opportunities or learning about strategies to become a successful student, contact me.
If you're interested in learning about resources, funding, or next steps on your path into the healthcare field, contact me.
If you're interested in learning more about the Office of Equity, Diversity, and Inclusion and the work we do, contact me.
If you're interested in talking with a counselor or would like to learn more about resources on self-care, contact me.
If you are a junior faculty member with a doctoral degree interested in expanding your research, contact me.
Bear down.
So that was our fun video. We tried to make it more like a TikTok, trying to be savvy with all of you young folks out there doing TikTok dances and all that kind of fun stuff. But like you saw there, we have a lot of different services within our office. And so definitely if you want to learn more about those, we work very closely with Josie and her team so she can make sure to get you connected, as well as, you know, just reaching out to myself, and we'll make sure you get connected with those opportunities too. The big thing I do want to emphasize to folks today in this blast, though, is AZ Hope. And so for some folks, if you haven't heard about AZ Hope, we've been trying to push it everywhere. This is a really great opportunity for students who are interested in health sciences. So for everybody in this program right now, we have a specific program or path for you in this AZ Hope program that we have here. So we have paths for students who are in high school, you know, transitioning into college. We have paths for students who are already in community colleges, looking at transferring into U of A or four-year institutions. We have paths for students who are undergraduates, paths for students who are in graduate and professional schools. And so the big thing with AZ Hope is it's really targeted at students who are health science bound. So if you're thinking, I heard a lot of folks saying doctors, DOs, PAs, if you want to be a public health administrator, things like that, we are definitely in line for having opportunities for you within this program. And the big thing with this program is we're wanting to have students who are, fairly competitive. So you at least have to have that 3.0 or above. And then there are some different requirements for this grant. So this funding actually comes from a HRSA grant, which is a national grant that we received. And so we're entering into year 3. And so for students that potentially are interested in this, reach out to me. We can always see if you fall into the eligibility. But the big thing we always ask students is, are you qualified for the Pell Grant in general when you're doing your financial aid? If so, you'd qualify for this. And essentially, if you attended any public high school within Arizona, you'd also qualify for this grant opportunity. And so with this, we have a few different opportunities actually open right now. And so I definitely want to give a shout out to our community college folks that are in this session here today, because I just went and checked our numbers and we don't have that many community college applicants at the moment. And so if you are a community college student, you're thinking, wow, I'm interested in AZ Hope, I want to learn more, definitely reach out to me and go to some of this, go to this website here to apply. Oops. So I do want to break down these different opportunities with you pretty quickly here. So our AZ Hope Ambassador Program is a program that's really designed to support and mentor students along their path into the health sciences. So we have students all the way from the undergraduate, from community college, from graduate and professional students. And with this ambassador program, what happens is you get a stipend, which is huge. I know we try to make all of these different programs have different funding opportunities just because we know that's really important to students along this path. But in addition to that, you get paired with a mentor. You have a peer mentor, which is really great because we know sometimes you just want to be able to talk to somebody who's kind of in that same space as you and going through some of those similar experiences to ask those questions. But then now we're also having students be paired with professional mentors. So if you are interested in becoming an MD, we'll try to pair you with an MD so that you can also ask those questions with that individual as well. Additionally, we make sure that you get connected with Renee or Ethan or Josie in the pre-health office, and we're on that right path to making sure you have all those academic requirements in place. And then we have you meet with a learning specialist so that you kind of get those tips and tricks and strategies and have next steps in regards to what that applications that you need to be doing and just making sure you're being really successful academically there. So AZ Hope really entails a lot of different support systems and components there. There is an essay, and this is really just asking why you're interested in this program and kind of getting to know you a little more. We also want to know where you learned about this opportunity. So you can say, I attended the pre-health blast. It was amazing. I saw you all talk and share about it. I love it. So that's our one opportunity that we have open right now. We actually extended the deadline, so it's till November 25th. And with that, we really just need you to get the core application in. So that's those essays, your application, which asks for different demographic information. And then there is a letter of recommendation that's required with these applications. So that's just some professional that you've worked with who really can attest to your abilities. So if you don't think you're able to get that letter of recommendation in by the 25th, just send me an email and we'll work with you to get that letter sent directly to myself. So that's ambassador. The other opportunity, and let me just check the clock real quick here. Okay, I'm gonna fly through this, y'all. Second opportunity is scholarships. So we have scholarships available for community college students, undergraduate students, grad and professional students. And you'll see here it's at all different levels, depending on what you're gonna be applying for. Shout out to community college students. We definitely need you to be applying because we don't have that many community college applicants at the moment. Again, with this, there's gonna be an essay and a letter of rec. So that's the second opportunity. Additionally, the third opportunity we have is going to open up in January, and this is a summer bridge program. This is a program that's really going to be designated for students who are going to be transitioning into the U of A. So this could be first-time freshmen, or this could also be transfer students. So again, shout out to our community college students. This application will be opening up January 1 and closing mid-March. And because we're in our COVID time, we definitely had our first cohort this last summer. So I want to give a shout out to them. They were all online and they did amazing. They were able to get, part of this bridge program is you get college credits, both upper division and some additional credits, and they got paired with different mentors and support systems, and they're all able to do it safely from their homes. So with that, I know I flew through that next part, but if you do have any questions about anything, feel free to reach out to me. Again, Renee and Josie and Ethan, the whole pre-health team, they have our information. And I'm just super excited to be able to have this time to meet you all. And I will pass it back to Renee to get to our next presenter.
So Eliza, we do have one question, and let me see where it went. There it is. So the question is, does the student have to be accepted to graduate school in order to apply, or can they be preparing for the upcoming semester?
So if they are, that's a great question. Let me just, okay, for Tashina, hi Tashina. So with that, yes, so if you already have if you're applying for the graduate and professional program, you do need to be in that program. So you do need to have that acceptance letter to show us that you are going to be entering into that program. But if you're still in the application process and you haven't received that letter, we would suggest you to apply for that next AZ Hope cohort. Does that make sense?
Yes, thank you. Thank you, Dr. Yellowbird, for being with us this morning and presenting your information. And you'll be happy to know that actually our next speaker, as we were going down the list of the different things that the Office of Equity, Diversity, and Inclusion offers, we were on the site, kind of texting each other, because back in the day when this office was called Office of Minority Affairs, both Dr. Clements and I actually worked as student workers with Josie in that office. And so actually Dr. Clements did a lot of those programs like MedStart, what we now call SHPEP, back then was SMEP and MMEP, so she did that as well. And so it's kind of she was saying, she's like, if they would have had AC Hope back then, I would have applied to that too. And I said, yeah, that would have been perfect for you. So with that, like I said, our next speaker is Dr. Charlene Clements. And so I really want to thank her for being with us today. She also just told me that she did get called back last night to work. So we actually want to be extra thankful for her for waking up and being with us this morning. And so I will let her introduce herself and sort of tell us where she's at now, and maybe a little bit about her path, and then we'll still have a few minutes at the end for questions. But she also has said that we can share her information, and so if you have questions for her, we will share that later. So you can email her and she'll answer your question. So Dr. Clements, it's all yours.
Good morning, everyone. I'd like to apologize to you because I am terrible at using Zoom. And so if there's any complications, Renee can text me and tell me that things are not going through. So my name is Dr. Charlene Clements. I am talking to you from my house in Flagstaff. I am a full spectrum family medicine doctor in Northern Arizona. So I work for the Navajo Nation up in Northern Arizona. Unfortunately, we are one of the hardest hit areas in the United States right now for COVID-19. And so that's why I actually got called back to work to continue to help with what's happening in our hospital. I do what we call full spectrum family medicine. And what full spectrum family medicine is we joke and call it womb to tomb. I do everything. I do prenatal care. I deliver babies. I work in the inpatient setting. I am a clinic doctor. I do urgent care. And I think I have the benefit of being able to do all of those things because I'm a family medicine doctor and I get trained in every age and every age group and how we take care of those. My path to medicine is maybe a little bit different than some other people, and I'm really excited to see on the bottom of my Zoom box that tells me there's 124 people listening to us talk on a Saturday morning, which tells me that you're all typical health students in that way, trying to do as many things as you can to get ahead, which is great. I grew up in rural Arizona, so I'm from San Manuel, Arizona. My parents were teenagers when I was born, so definitely I was the first in my family to go to college. I'm the first on both sides of my family to go to college. I grew up in a crazy, happy biracial household with a very large Mexican family and a very large American family. And so I think I just had the best of both worlds growing up. I graduated high school from a high school with 60 people. So when I came to U of A, like Bio 181 had more people in the entire class than in my entire school. So that was definitely a tough experience to get used to. But like Renee said, Renee and I used to work in the college of, or now it's diversity and inclusion. I think we used to work, and it was minority affairs then. And I think that was the biggest thing. When you're a first generation college student, I was definitely a scholarship student. So I was terrified about losing my scholarships all the time. So we worked so many different jobs and so many different side projects that maybe I didn't have as much time as other people to be able to do tons of volunteer experiences, or I couldn't work in a research lab just for credit because I didn't know how I was going to pay my bills or what I was going to do to be able to pay for my tuition. So definitely, I think in that sense, I worked a lot when I was in undergrad because I needed to figure out ways to be able to pay for my tuition. I was also part of the cult of the physiology major, but I felt like physiology did not fit well with me. I felt like I didn't feel like I fit in well in those classes. And I felt like there was a lot of very competitive people in those classes. And by nature, I am not a very competitive person. And so I think I found more solace in like art classes that I took. And I enjoyed being in art history and all these other different classes as opposed to my actual physiology major. So by the time I finished undergrad, I had completed all the pre-med coursework, but I felt like I wasn't ready to go to med school. I felt like I wasn't competitive. I felt like maybe I didn't fit in like the other students because I hadn't worked in a research lab. I hadn't been able to shadow tons and tons of doctors because I worked all the time. And so when I finished undergrad, I wasn't sure necessarily what I wanted to do, but I was really excited to continue to study art for a little while. So I actually took the opportunity to study abroad after I graduated. I never did it when I was in undergrad, but I studied abroad in Italy for a while so I could learn about painting and how to like they restored cathedrals and all that kind of stuff. And while I was doing, I still wanted to be in healthcare and I wanted to do something in that vein. So I think I found that public health was really what inspired me that yes, I truly wanted to be in medicine. I have a master's degree in maternal and child health, which is beautiful for the job that I do now because I take care of tons of women and babies. You can take care of the mother in a family. You get to take care of the whole family because it's because of her that she lets you bring all your other patients to you. So I did not go to med school straight out of undergrad. I took about 3 years before I went to apply to medical school. And the best part when I applied to med school is everybody wanted to talk to me about studying abroad. No one wanted to know about the volunteer experiences I did when I was in undergrad. Everybody, all the people who interviewed me wanted to know what it was like to live in another country or what it was like to study painting or what it was like to do other things. And so I want to just kind of leave this message out there to everyone that if there is a seat for you at this table, if you feel like you're passionate about healthcare and you feel like you have something to give for your community, you can and you will. You might not feel like you can fit in the perfect pre-med mold that they make you see on TV or the way that sometimes hyper-competitive classes make you feel, but there is a seat for everyone. And never do we see that more than during the time of COVID right now. If we could have 50 more doctors at my facility, we would be excited. 50 more PAs, 50 more nurses. And it's just, I'm inspired that all of you are still encouraged to seek out careers in healthcare at this time, despite this being one of the worst anybody might have.
We can still hear. I think we can still hear you.
My Wi-Fi is terrible in Flagstaff. I'm sorry.
I did warn them that your Wi-Fi may be a little off, so no worries. All right. So does anybody have questions? Maybe you can either put them in the chat or I know this is, like Josie said, this is blast. So maybe in the future, when she's not super duper busy, we can ask Dr. Clemens to come back and have a little talk and do it a little more slow. But if you have questions, I would say put them in the chat and we can ask her, we can read out the question. Oh, so how is so I guess I will ask. So I guess how did things, you kind of alluded already, from, because you've been in flag and you've been working at your clinic for a little while. How had things shifted from like pre-COVID to now COVID, as far as like, the number of patients you see, or just, I wouldn't even say the amount of work because you always work a lot, but I think just a different type of work maybe now that you're doing. So how does that compare from pre to now, I guess?
So I feel really fortunate in my facility, that what is interesting is we also work with a group of doctors that are known as like the commission corps. So the commission corps officers are like government public health officers that come and work in our facility. We started getting briefings in our facility about COVID back in February. So we were talking in February, like, what are we going to do? And for a lot of people who don't know, the Navajo Nation in northern Arizona is actually incomparable in size to West Virginia, is how large it is. And so the reservation itself is split into what we call CHSDAs, or like health service districts, in which we deliver, like, this clinic or this hospital is responsible for like this section of the Navajo Nation. So we started actually taking the briefings that our public health officers were getting seriously back in February, because we're like, if this hits us here, this is going to be bad. This is going to be really difficult. We saw our first, we were hoping, by the basis of isolation, being isolated in rural northern Arizona, that hopefully it wouldn't hit us as hard, as fast as it did. We kind of traced the outbreak that happened with us, that kind of kicked everything off. That there was a group of people who traveled to a basketball tournament in Tucson. So in Tucson, a lot of people got exposed, but then came back up, and there was several different like church groups that met together. And unfortunately, it just spread. It spread rapidly. We saw our first case of COVID in my facility where we were at the end of March. And then it's been pretty significant since then. Like our hospital has 18 beds that we have, and our facility is unique in that we share a community hospital with, it's split between both the Navajo Nation and the community in northern Arizona. So it's like we take care of both Native American and non-Native American patients in our facility. We have 2 ventilators in our hospital where we are. We have one that we keep in the ER and one that stays on the floor. And so with 18 beds, you can imagine that there's not very many people that we can admit when the hospital gets really hard hit. And like the challenge, and hope that they breathe a little bit easier, or hope that they can be a little bit more comfortable. In our peak, we were swabbing about 200 to 250 people a day for COVID. Like, those were the lines of people that we had outside our clinic. We instituted like drive-up testing. We started doing drive-up testing in April. So that was probably, you could get tested with us faster than you probably could get tested in other places in Arizona, just because we were worried about how bad this was going to go, And our facility, because we share it with the community, we actually created one hospital service where it wasn't just IHS doctors and the community doctors. We became one hospital service and one team, so that we could take care of everybody. Because at that point, we're like, there's no sense in having 2 separate work teams. We needed to work together. We improved for a little while there. Things were getting better, and I think with the whole state of Arizona, things are looking pretty terrible again. Like last night we had overnight, which is fine when it's stable, but when they're unstable, 8 patients is very, very difficult. And so that's why we went back to health, because we commute about 50 miles. I live in Flagstaff, but then drive about 50 miles to go back. And so we kind of work on a team schedule to help take care of everybody. So it's a very interesting time. We have medical students rotating with us right now from the University of Arizona, and we have to be very careful to not expose them to COVID patients, or make sure they're not taking care of COVID patients. But some days you don't know who's going to be a COVID patient, So it's been rough. It's been difficult, particularly when you see how this virus has devastated an entire community, and you see elders die who are the keepers of the language and keepers of the culture, and you have people who die in rooms by themselves because we can't let other people come into the hospital. I think it's been very emotionally exhausting for everyone in this country, not only if you're a student, if you're a doctor, if you're a lay public health person. It's a weird time we're living in.
It is, and we thank you for everything you do because we're sure it's not easy. And I know you've mentioned in the past to me that even you all doctors and nurses are sometimes rooming together because you don't want to send someone back home to their families and expose other people. So we do thank you for everything you do. There is one question that came up. And the person asked, any advice for how to make the most of gap years for non-traditional pre-health students?
Yeah. I'm looking here, and it looks like, is it the question regarding how to make the most of the gap year? Like,
right.
I think, which a gap year is wonderful. I don't want anyone to feel like it's something that they can't do. If you're of the mind that you feel like you need a break, taking that break is huge because it means that your brain needs to be rested before you take the next chapter in your life, because it's difficult. Medical school is difficult, residency is difficult, so you need to be in the headspace to do that. I would tell you, take a gap year, and if you're doing something that you're passionate about, it's going to reflect into your applications. If you took a gap year because you're really interested in sea turtles and you wanted to swim with the turtles in another country, why is that important? Because it taught you what you're passionate about. It taught you what you needed to make yourself happy. There's ample opportunities during a gap year. If you always wanted to volunteer to do something you never thought you had the time to, take that time, because you're never going to get it back. Medicine is going to be a career for the rest of your life, and you're not going to have these opportunities to pursue things that you think you might be interested in. I recommend it.
Well, thank you very much, Dr. Clemens, for being with us today. And seriously, and obviously on a personal note, thank you, because this is kind of a little, we were talking yesterday, and it's like a little full circle because, when we were undergrads, the Office of Equity, Diversity, and Inclusion used to house FACES and the FACES internship. And we used to do a FACES conference, which was actually very similar to this. So I told Charlene yesterday, I said, remember the FACES conference? I said, think that. She goes, oh, okay, I know what it is. And then the FACES internship now is very similar to Med 493A. It's a very similar experience. So again, we've been around, and with Josie too, we did a lot of these things. So thank you, Dr. Clemens. And so then from here, we will go on. So the first panel is about to start. And so I will let the two ambassador facilitators take it from here for the next panel. So panelists for panel number 1, be ready because you are up next. Thank you. And thank you again, Dr. Clemens.
Bye, guys.
Thank you. And for the transfer students, we're gonna.
Oh, yes, sorry.
I'm gonna log off this Zoom, and for those that were registered for the transfer area, we're gonna go to a different link. So Renee, can you put that transfer link in the chat? So anybody who is a transfer student or representing a community college, we're gonna have separate breakouts. So I will be over there. I'm gonna go ahead and log off, and I'll see everybody else over there.
Yes, and here is the link for those of you who are at a community college or have not transferred yet, or an advisor at a community college. Here is the link in the chat for that other Zoom room. So you can go in there. You'll have some panelists and some speakers in there as well, and you'll go over similar talks, but there will be more specific to community college and how to prepare before you transfer. All right, so I will let my ambassador facilitators take it from here.